welcome back to my channel. If this is the first time that you are here, thank you so much for joining me. My name is Kitty. I am a registered general nurse. I'm also an IBCLC International Board Certified Lactation Consultant, a birth and postpartum doula, and a hypnobirthing instructor and antenatal educator. I'm also called mum by three little people, and I've had some incredible birth experiences, and I want you to feel educated, empowered, and excited to meet your little one and nourish them. And today's video is going to be diving into the topic of oversupply when it comes to lactation, when it comes to a baby who is getting too much milk. And I wanted to talk about this in a real casual way because I cannot deep dive for your particular scenario. And when it comes to something like meddling with your milk supply, it's something that really needs the support, the hands-on support from a lactation consultant who can come, who can see your baby, who can see how you're nursing, and who can weigh your baby and see how their nappy output is and things like that. So don't take these suggestions as focus for you, but take this instead as a little push, a little nudge for you to go and seek some expert lactation support who can come and see you in person. So I'm a lactation consultant, but I'm not your lactation consultant. That being said, let's dive into the topic that is oversupply. The first thing that has to be said is that when we're talking about clinical oversupply, so that is too much milk, we also have to look at the factors that might be the alternative diagnoses. So that might be, first of all, that our baby has maybe a tongue tie, some sort of a latch that is stopping them from properly draining the breast. So as a result, you maybe get pockets of fullness around the breast. We have sort of quadrants of breast tissue all the way around. And if you're noticing maybe that one quadrant is always full, even directly after you've nursed, what's happening is improper drainage. So maybe it's down to some tethering, maybe it's down to an improper latch, maybe your baby's got a tongue tie or a lot of tension there that's stopping them being able to drain the breast fully. So you want to outrule that. The next one is that maybe your baby's latch is fantastic, but what we have is a very forceful or fast milk flow or that milk ejection reflex. As a general rule, we have between 2 and 3 milk sprays or that milk ejection reflex per breast per feed. And the first one comes with the most force. So what I would say is if that's you, that you maybe look at how you can optimize your baby's latch, maybe look at doing a bit of laid back feeding position, maybe look at sort of putting the brakes on one of those quadrants so that the milk spray can be dampened a little bit. Generally, like I said, it's just for that first milk spray. So looking at what you can do to dampen that down. So we've been joined by a pear-eating little baby. As you will have noticed, he's joined me in a couple of videos now because he doesn't want to be with anybody else but mummy, which is fine. So when we're looking at all of those other factors that could be taking into consideration there, when we're talking about clinical oversupply and making sure that that is what's going on, we're looking at things like a baby who is gaining weight exponentially. So, their curves are just going up and up and up. We're looking at a baby who maybe is unsettled between feeds, and this is generally down to the significant amount of milk that they're taking in, but also what happens in the gut. So with a huge amount of milk, they're getting a lot of that sort of initial milk, which is the sort of watery foremilk that we call it. And what happens with that is with the significant amount of milk, we get a lot of lactose, which is of course the protein that is available in milk, or the sugars that are available in milk. And with a lot of lactose, we want to break it down with lactase. And with an overabundant amount of lactose, what happens is the lactase isn't present to break it down significantly enough. So babies will often have very gurgly, sometimes sore tummies, and as a result we see those really green, frothy, like the top of a cappuccino type poos. And they can also have some mucus in them, a little bit of blood streaking, and this is where typically I would be saying, like, this is what we need to do something here with regards to just regulating mama's milk supply. So when it comes to actually stepping in, what sort of instructions would I give around reducing milk supply, dampening it right down to make sure that it actually is adjusting to your baby's required needs? The first thing that I would say is you're not to do a single thing until such time as we get to that sort of 6 or 7 week mark. Generally what happens around that stage is our body initially makes that sort of abundant milk supply, and then it's tailored down to our baby's needs. So things might regulate themselves out and you'll notice less fullness, less unsettled baby come that 6 or 7 week mark, when the ratios of casein and whey in our milk even themselves out and our supply evens itself out. What I would say in terms of a more conservative measure that you can do is, alongside obviously seeing a lactation consultant, outruling any oral ties, doing a full oral examination, making sure your baby's latched on and attached well at the breast, is to follow the first breast first rule. First breast first. So when we're thinking of that, we're thinking about your dinner and your dessert. So just in the same way, when you go out for date night, your dinner is always first. We eat all of our dinner, and then we know that our dessert is on the menu, but we're not always in the mood. So you're offering baby the first breast first, so their dinner, and then you might offer them the second, and sometimes they'll take it, sometimes they won't, but allowing them to feed for as long as they like on that first breast first. And what's happening there is you are working to regulate your supply out in a way that is suiting your baby's needs. If we are going ahead and maybe checking the clock and saying, okay, 10 minutes each side, or we're going backwards and forwards, what's happening is we're telling our body to actually make more milk. And that's where we can run into trouble with an oversupply. So following the first breast first analogy can be really helpful. So wait until the 6-week mark, and it might all even itself out regardless. And then after that, we're talking about using the first breast first analogy. And my last tip then, and really this should come with some more specialist lactation support, and this is where you are doing block feeding. And the reason that we talk about block feeding being something that we want to be overseen by a lactation consultant is because it can work really well. And what we're doing here is we are purposefully reducing your milk supply. So you can use all sorts of tinctures and herbs and medication to do this alongside block feeding, but block feeding in itself essentially is talking about spacing your feeds purposefully. So the way I like to do this is I like to fully drain both breasts first thing in the morning. So you're talking about doing maybe 1 day of block feeding initially. So you're using an electric double breast pump, draining both the breasts fully, and for the remainder of that day, you are doing 1 breast per feed. So you're talking about using the left breast, and the left breast will be for that feed, and again for the following 2 hours. So you're doing 3 hours of 1 breast. The next following 3 hours then will be of the alternative breast. So what you're doing is you're sending a really clear message with the breast that is then full that says to your brain, we don't need to make milk at this time. So you're slowing down the supply. And then this generally is enough for, by day 2, things to have settled out a little bit more. And then your lactation consultant would be working with you. And if your baby is more settled, your breasts have become a little bit less full, you might be absolutely fine to continue to nurse as you had been previously with just 1 breast per feed. That's block feeding in a nutshell. It really does need to be a more personalized thing, so definitely working with a lactation consultant who can come and weigh your baby, do weighted feeds, see how much milk your baby is transferring. You want to be also doing things like a little bit of breast massage to release the kind of fatty hind milk, the globules of fatty milk that are sticking to the inside cells of your milk making tissue, so that you are making sure that your baby gets that nice fatty milk content. And I hope you find this helpful, just to understand. No, thank you, baby. To understand a little bit more about what an oversupply is. There are many reasons for oversupply. Sometimes there's too much prolactin in mama's body. So there's an awful lot of prolactin. That's, of course, the milk-making hormone. The milk-making hormone, so we make an awful lot of milk as a result. It might be due to a pituitary tumour maybe, or a growth there. It might be due to the fact that you have maybe been doing some supplemental pumping, some topping up with the pumped milk, and so you've created an excess or an oversupply through that with topping up in the early days maybe. So looking at all these different factors will help you to get to the root cause of it, and starting with those really conservative measures can help you and your baby become more comfortable.